in here of what's going on next door now.
Yeah.
Okay, we're live. This is Center for Friday, January 31st, all day today. And we're talking about the Budget Adjustment Act. Today we have Dale in to come and talk about the budget recommend for your department. So if you would introduce yourself for the record and anybody else you have from your department, and we'll also introduce ourselves.
Great. So I'm Dr. Bowen, Jill Bowen. I'm the Commissioner for the Department of Disabilities, Aging, and Independent Living, Dale. It is my first cycle, not here yet for more than 9 or 10 months. So it's my first cycle with you all. Come from Philadelphia most recently, where Commissioner for Mental Health, Intellectual Disabilities, Substance Use. So I bring that work with me as well as work I did in New York City. But I'm happy to be here and get to know you all. With me today is, you want to just introduce yourselves? Okay.
I'm Angela Smith-Jang, I'm Deputy Commissioner.
Bill Kelly, Finance Director.
And Stuart Sure, General Counsel.
And Rebecca.
Rebecca Silvernagle, Principal Assistant Dale.
And on the screen, Jen.
Jennifer Garabedian, Developmental Disability Services Division Director.
That's the Dale team. Very fortunate to have such an incredible team in leadership for Dale.
I'm Pat Brennan. I represent Grand Isle County and a little bit of Colchester, all of Colchester almost. A little bit of Colchester.
Jenny Lyons, I represent Chittenden Southeast.
And I'm Andrew Persick. I represent the Washington District, Washington County, Stowe, Orange, and Braintree.
Great.
And I'm Rich Westman. I represent the Lamoille District, which includes arguably the best town in Franklin County, which is Fletcher.
Bob Norris. I represent most of Franklin County and the town of Alborg in Grand Isle County.
In Washington, in the Washington District, which is Washington County, Stowe, Orange, and Braintree.
Wonderful. Got everybody.
That's everybody. It's Senator Baruth. If he comes in, we'll sit there. So I think we only have 2 copies on this side. So I have copies of your handout or your presentation.
You want to put it up, Jen, when we do it?
I think if we have it here,
You're good.
we don't need to put it up.
Okay, great. Okay.
He's here.
There's only 5 copies.
That's okay.
It's good.
We'll
We're good.
share.
We'll share.
We'll share.
Okay,
So he's here. Okay.
he's here.
So I'm going to start by describing the department, and then we'll go into some of the numbers. I know we have limited time, but we're happy to answer questions here or follow up as needed. Our mission statement is to make Vermont the best state in the nation in which to grow old or live with a disability with dignity, respect, and independence, and everything we do needs to align with that. The department has 5 major divisions, and they all contribute to achieving this mission. The first that I'll discuss is the Division for the Blind and Visually Impaired, and that division is focused on assisting Vermonters who are blind or with a visual impairment to enter or return to work. It is focused on vocational rehabilitation, but has wider implications for people with disabilities, especially through Pathways to Partnership grant, which is very collaborative across agencies and departments, and focused on high school age children, youth transitioning into the workforce. The Adult Services Division is responsible for long-term services and supports to older Vermonters, as well as individuals with traumatic brain injuries and adults with physical disabilities. I do want to just say for the record that we all know that the demographics in the state are shifting. One of the fastest aging populations in the country, and within a couple of years will be about 1/3 of folks who are 62 and over, and it's critically important that we are ready, prepared, and have a good plan, which we do. Great Strong Vermont is a multi-sector, multi-year plan that is now completed year one of a 10-year plan and implementation, and we'll be happy shortly, there will be a review of the first year summary report. The Adult Services Division does work with private organizations and public organizations and partners, and does provide a broad array of long-term services supports, and those include residential support, community support, case management, family supports, respite, employment support, crisis services, clinical interventions, assistance with activities of daily living, or ADLs, assistive technology, guardianship services, nursing home level of care, rehabilitation services, supports that live at home, etc. So I said them all because I'm not sure people realize the range and breadth of the services that are designed and really supported through Choices for Care, which is, most of those services fall under for people who are eligible for home and community-based services, and then there's the nursing home support level. As well as individuals who have a whole array of physical disabilities regardless of their age. And this division seeks to ensure that basic rights, human rights and civil rights and health and well-being and safety, and really addressing things like ageism and stigma are a part of the package. The next division is the Developmental Disability Services Division, which is responsible for services to people with developmental disabilities. It includes guardianship services, people with intellectual disabilities. It's also a broad array of long-term services and supports in the community. There's, again, systems of care in terms of looking at the whole continuum and the importance of family supports and caregiver supports, residential supports and crisis and clinical intervention, respite and rehabilitation services. Supports older Vermonters and Vermonters with disabilities, again, across the age span with developmental disabilities, and its goal is to ensure that individual goals and preferences and choice, again, are critically important to building the services. There is a range of agencies, designated agencies that are providing direct support, and specialized service agencies to the people that are served through DAILS programs. The Division of Licensing and Protection performs that critical role to ensure that there's quality of many of the healthcare services, protecting vulnerable adults from abuse, neglect, and exploitation. So the Department of Licensing and Protection is divided into two sections. One is survey and certification of our healthcare programs, and the other is adult protective services. The Division of Hireability assists Vermonters with disabilities to enter or re-enter the workforce through a wide variety of programs all over the state. There are district offices everywhere, and really enables Vermonters to assess their skills and their abilities and identify vocational goals and develop plans for employment. This is particularly important given that we have needs to fill vacancies in really every sector. One of the important services they provide is to be partnering with the VDOL, Department of Labor, as well as the manufacturing sector to understand where the skill sets, what are the skill sets that are needed to fill some of these key positions, and being able to provide training so that we're matching need and skill. So now I can go into some of the numbers unless there are questions about the program, the department. So the overview for the BAA for 2025 fiscal year, you can see at the top there is the 56,226,879 total net increase, all funds combined. And I'll just walk you through this overview, and then we can look at each of the subsections. The increase for Digital services, this is the fund increase, 242,000. The collective bargaining agreement that
Can I
was,
ask a question on the internal services? Is that different than the SLA, the service level agreement? Or is that kind of in part of the internal service fund for ADS?
It's part of.
Okay, so you got a bill at the kind of this October or something that from ADS that you
Yeah,
use more services than you would thought, or just?
it's a basic, just, we're getting billed for more than what was in our budget. And I think Age has put a summary together for the whole agency of what these costs refer to.
Well, sort of, and then, but when we asked them, they said ask the department, but then when we asked the departments, they tell us to go ask ADS. I think the answer was like, they said it was like in your detailed bill, so you'd have to go back and look at that to find out exactly what it is, but sometimes they call it a SLA, service level agreement, sometimes it's just internal service fund, and I think those are two different things. So I wondered if this was SLA changes, or had they actually changed the internal service fund equation?
SLA,
Okay,
it's on the ups and downs.
right, okay, thank you, that's all I need.
and then, as I said, the collective bargaining agreement, asked me is the just under 3.2 million. The choices for care, the nursing home Medicaid bed day pressures, is 77,755 days. So that's the $24.5 million of the bed day pressures.
No,
I think we would take questions.
Go through the whole thing?
No, I think it's
Or
better.
should we break up?
We should break it up and then have questions as they could get to that number.
So I understand in the budget adjustment, there's $729,986 in carry forward in choices for care. And I'm sitting there, and the underlying statute that created choices for care and going back says that we reinvest all of that. And particularly given the fact that so many people are having trouble within choices for care, finding labor to help the families maintain people. And given the fact that we're gonna get to the lines where nursing homes are, and we wanna keep as many people happy in choices for care as we can, what's happening with that money?
The carryover dollars?
Yeah. And
For the
what's
record, Bill Kelly,
and
Finance
what's the
Director.
intention?
So I'll just lay out the facts that the statute, which is Title 33, and we could bring it up, Chapter 77, I believe. Don't quote me on that yet. However, so the statute doesn't say exactly what you mentioned. The statute, and per closeout in state fiscal year 24, the way it works is up to 1% of the previous year's expenses we keep as a reserve. And so the closeout funds that were available at the end of state fiscal year 26 are less than that 1%. It's whatever goes above that 1%, then we can reinvest. The 1% reserve is to prevent, unanticipated caseload pressures requiring us to implement a high needs wait list. And I've been in the department since the beginning of Choice for Care back in 06. We've only had to implement a high needs wait list. This is the state implementing a high needs wait list due to fiscal concerns in the appropriation. We've only had to do that twice. So this reserve has prevented us from having to implement a wait list and continues to do so for state fiscal year 25. So it's anything over a 1% that we get to reinvest,
Mhm.
and that it didn't reach that threshold.
Okay, that's good.
It's chapter 76 of the,
Section 7602.
So we're at the choices for care nursing home transition from rug 4 to PDPM acuity calculation method. The 1.3
You have
million.
a question on that?
Just, it would be helpful to explain what Road 4 to PDPM.
Those are methodologies for determining acuity, the calculations for acuity. The PDPM, which is the newer model, the one that is used widely, calculates a slightly higher acuity for the presentations, and therefore the cost is higher. And that's what's represented by the 1.3. The choices, we're good? Move on?
Yeah.
Okay, the choices for care estimated nursing home pressures in terms of the EFRs, or the emergency or extraordinary financial relief requests, is 21 million.
Commissioner, can I ask a question on that? So that, when they make this request, they fill out a form, or several forms, I assume, and send it in, and then you guys do the financial due diligence on whether to grant it or not? Can you just explain the process?
Yeah, so this is done for AHS in a coordinated process. So DEED is involved. There's a review process for what is being requested. What does it mean in terms of their ability to continue to function? What's at risk in looking at what those cost pressures are. Many of them are inflationary. Many of them, if not most of them, are related to nursing costs, especially the need to have contract nurses or traveler nurses. In the nursing homes, it tends to be licensed nursing assistants or LNAs that are the kind of the backbone. Very, very hard to fill those vacancies. There's a lot of efforts to try to address that, but the costs are astronomical. And I do want to say that it's not unique to Vermont in terms of these stressors.
These EFRs. And then.
Well,
yeah,
the pressure, the cost.
Right, the traveling nurse cost.
I'll just add to what the commissioner said, the requests go to the Division of Rate Setting, which in DEVA, and they follow their rate setting rules that you can look up online.
Okay.
And the overarching, the main threshold they need to meet is if they're at risk of closing.
And these are for-profit entities.
Most of them.
Not all.
And what they request and what they receive is not necessarily the same thing.
And are sometimes the requests denied, that's it.
Yes, sometimes they're denied. But in many cases, especially in the last few years, it has been unfortunately necessary. And we are looking at different ways in which we expect that to stabilize, not necessarily be eliminated, but should be reduced. And that includes the nursing rebase that is due to come in state fiscal year 26. And what we would expect from that is that the rates are adjusted to closer to what the costs are. The last time there was a rate rebase, because statutorily it's done every 2 years for nursing homes, but the last time there was a rate rebase is always based on a 2-year lag. And so when it was done for 24, it was based on the 21's year, and that year was a pandemic year, and so the costs were just lower for nursing homes, and so there was a really a gap between what the rebase was for that reality in 21 and what it was by the time they reached 23. This time, 26 will be based on 23's year, which is closer to, so there should be some stabilization, and hopefully not sitting here next year saying, oh, we still have these really high EMRs. I don't think that they will be eliminated, but I think that we will see some stabilization.
Good.
Yeah, that was great. She answered one of my 2 questions. Do you mind?
Yeah.
that was great because it answered, because I couldn't remember in my head when the rebasing was coming, and that should take care of a piece of this. And what the gap is between that will be interesting to see in that. How much of this 21, I've seen the list and there's some that we've approved, some that are in the pipeline. But how much is out there that looks like it will be spoken for in this 21? Because if we're only at the end of January and only helped half of the 30 some odd nursing homes, we're liable to have somebody else show up.
Well, the 21 million represents what has already been approved plus what is estimated for the balance of the year. So this is.
So there's no.
Can you give us the breakdown of what's been approved?
Yeah, there's approximately 17 million already, executed in a EFR order.
Yeah.
And the average EFR is about 1.5 million per request. So we have room for 3 or 4 more.
Yeah, that's my question, yeah. Because when we finished the budget, we knew that we had spent all 18 extra that was there.
Right.
So I'm just asking, is there any room for anybody else? Because we're liable to have them.
I mean, we're obviously hoping there's more, but.
Yeah, but.
This is our best estimate right now.
No, I get that, and that's helpful that there is the possibility for at least a handful more.
Yep. Thank you for those questions. And then the veterans home, the cost settlement portion for us is just under 4.3 million. And then I think we talked a little bit about the carry forward 1.7.
This veteran home, this is different than the veterans homes, or is it the same thing?
This is
Bennington. Right, but I mean, because the veteran homes also has a line in the BAA, but it is just the same thing. Yeah, okay.
That's what Dale's contribution.
Yeah.
So you have to have Dick Sears with a little A over top.
No, he'll jump out of the photo if I
So this breaks it down. The internal service fund is under the B329 administration for the 242 and the 1 million. Okay, the 1 million I will just mention, this is a general fund transfer from a higher ability grant. This is just a technical fund code requested by the grantor to have the administrative piece of it in general fund and the program piece of it in the grant fund, and so it's a neutral, just technical move, just reflected here.
Yeah, I could add, it's related to a federal agency audit for the Section 110 program and the way they want us to code funds in the fund accounting world, that the general fund will be used more in the administrative appropriation rather than the grants, the direct service. So we're just making that accounting correction.
Okay.
Okay, and then under 330, B330, the Dale grants for adult services division was the collective bargaining agreement. And that was the increase for those who provide independent services, which is what we directly do our collective bargaining agreement with. And then for the DBBI grants, the Department of Blind and Visually Impaired, there were no adjustments requested. Higher ability, this is the same, will show up in both places. From here, two different accounts. And again, you'll see in this case, this is the bonus, whereas before, you want to just explain the two different parts of the collective bargaining agreement?
Certainly. So
one is developmental services, and one is under the adult services.
Justice Care,
Yep.
yeah. So the collective bargaining agreement is an agreement that the state negotiates with the union representing the independent direct support workers, which total anywhere from 5,000 to 10,000 at any given time in the state. And these are individuals who are employed by the consumer, by the recipient of services. They're not employed by agencies. So there's an employer-employee relationship between the consumer or their representative and the employee. The state, by statute, was required to negotiate every 2 years with the union. And as a result of that, there is generally, and there always has been since I think 2014, there's been an increase in the hourly minimum rate that an employer, consumer, must pay to their employees. So those are the costs. It covers a number of programs, most notably the Choices for Care program, and people who are working for individuals who receive services like Choices for Care, and also for those who receive developmental services. There's a $14.75 minimum rate that every employer must pay at a minimum, but they can always pay above that. But the state is not an employer, we're not a third-party employer or joint employer, so we stay out of it other than to set a base rate and then to make sure that the budgets reflect an ability of those consumers to pay the $14.75.
Is it always off schedule with our fiscal year? Because what if we didn't approve it?
Well, yeah, there's a provision in the statute in Title 21 that says that the parties will negotiate an agreement. Well, if they're unable to negotiate agreement, what happens is it comes to the legislature, and the legislature decides whether to appropriate the funds that are necessary for that. We hardly ever, I don't think we ever have, reached an agreement prior to or during the session. We generally reach that in the late spring or early summer, so it can take effect on July 1st of each year.
But this year it came effect afterwards because you're making adjustment of this fiscal year.
So I think the point here, it's a 2-year agreement, so when so the first year it's a BA.
Okay, now next year.
And you'll see different parts of it, that's why it shows up a couple different
Yeah.
times, the bonus for this program, for that program.
Yeah, there is a year 1 bonus under this 2-year agreement, and that's why it's reflected in this BAA. And it's a retention and recruitment bonus to encourage workers to stay in the field. And so if they work a certain number of hours during this fiscal year, at the beginning of next fiscal year, they'll be entitled to a bonus based upon those number of hours worked.
Yeah, and I've heard from a lot of constituents that it's hard to find these people. So I understand why we're needing to do a retention bonus.
Yes, you'll soon see a campaign in the media trying to help let people know about these opportunities and inviting them to join the direct care workforce. We're now in the Choices for Care, so in addition to the collective bargaining, you're going to see the nursing homes. This is the adult services, mostly serving older Vermonters. So you can see the same things we talked about. The Medicaid bed days, the nursing home transition from Reg 4 to PDPM, and the EFRs, and also the carry forward, which we discussed, and the veterans home. So that is the
bed day pressure is just usage, so more people needed the bed.
correct. When we are watching what is happening with the nursing home utilization, and of course it dropped, as we know, significantly for several years during the pandemic. It's actually back to pre-pandemic levels, and so it started to level off a little bit. It did go a little bit higher than we had budgeted, so this is that.
Okay. I don't have any more other questions. Anybody else in the committee have any questions for me? No. Thank you for your time.
Thank you. Take care, all.
Yeah.
Meeting to see.
So committee, we were gonna hear from the treasurer's office, but Ashland is also sick. So this sickness is going around, so we do not have that, but I was going to suggest that we go through this document some more before we adjourn, but we will probably adjourn early, which I know people don't like to do on Fridays.
Hate it when it happens.
We'll take one for the team. Yeah. So we left off, I think it's page
4.
Page 5,
Five.
5,
Like we made our way through 4 or 5?
5.
Oh, yeah, right. So page 6 is just that one, the veteran phone, which we talked about. And Amy, wasn't there something else that they explained at the beginning? They're going to do the veteran phone budget different this year than other years.
For 26.
Did we do 6?
Oh, for
Did we do
26.
veterans home yet?
No,
Here
we're on
they
6.
did not.
We didn't do it yet, okay.
Just right now.
I
They
didn't think
do like
so.
the settlement, every year.
Right, so this is the settlement, so this is the issue that Gresham said we'll have to cut. This is also one we'll have to pay this year and next year, the one we do.
So next year, you'll have the actual cost, so you hopefully won't have a VAA.
For the veterans, so next year.
That's right, that's the plan.
So we're seeing in the VA and FY 26.
Yeah.
Okay, assume we don't have any questions there. Then we get to Senator Bruce section, education.
Nice.
No problems in education.
The adjusted education payment, that was for when budgets came in lower than anticipated, right? That's why that was at $11 million. So when there's this negative here, there could be an argument made that that should stay within the education fund, but then if you did do that, you'd have to cut $11 million out of MR.
So where it says on the $3 million, the General Assembly did not reduce this appropriation when a separate appropriation for ELL was established. Are they referring to the weighting?
Yeah, in Act 127, we started doing those categorical payments for yourself, like the base payment, remember? Then you had number of, with the weighted, you could get more. Because if you just had one English language learner, just getting the weight, you couldn't hire a teacher. So you got like a base payment even if you just had one.
Got it.
But I guess we kind of like double booked it, the way I read that. We did it twice. And then, so the 8 million was that the budgets came in on slightly lower. And then universal meals also came in lower. But, and this is the hard thing about these, you don't really know, that savings, those downs, but those were used somewhere else in the budget. There's not like a direct line. Okay, higher education, no changes. Natural resources, very small dollar numbers from Forest Parks. I'm not having them come in because I figured these were too small to spend time on. Nothing for commerce, nothing for transportation, nothing for debt service. Then we get to the one-time appropriations. So the first one we had talked about several times that I see Senator Norris has highlighted. And we heard new information about the survey that, I don't know if you've heard, or you've heard, Norris, that Amy told me yesterday. Do you want to tell the committee what we learned?
So this is the, for VDH, this is the health insurance survey. There was some conversation about whether or not that money was available. But this is a contract that's already been let. They're already doing the work. So this money will be expended by VDH.
So from last year's budget, they got $400,000 for the survey. They signed a contract for $550,000. So if we were to deny this, it wouldn't stop the survey. They would just have to find the $150,000 somewhere else in their budget.
So do we know when they're gonna re-up it or attempt to re-up for
It's
this
every
again?
2 years or 3 years?
3 years.
Every 3 years. So you gotta get reelected. We might wanna, if we're concerned about this, we might wanna put in language about something around the next time. I don't know, we could do something like that. Oh, yes, there was.
The difficulty that the agencies in this place is they're statutorily required to do this the study. So you're stuck with the study and they estimate what the cost of the study is gonna be, and then they get bidders in, and I think they had very few bidders in this. So they only had 1 or 2 bidders in this, and they took one of them. I would, in their defense, say they're in a rock and a hard place, because the statute says you're gonna do it, we put some money in, and then when it isn't just exactly right, it's normal in a budget adjustment to do a truing up. So I don't wanna beat them up too bad.
Sure.
No, I don't want to beat them up. I mean, the question is the report essential? And apparently, the House Healthcare Committee has said they use it regularly. The other question is, maybe this is a question for GovOps when they look at reports that are
Obsolete.
essential.
Right, especially a report that's $550,000. If it was a $20,000 report, it would be a different, it's statutorily required when you don't know what.
And the data is, in talking with Joint Fiscal a little bit, the data apparently is available. It takes a little more time to get it, but it's there.
But I would say, for the agency, that's not their call.
Right, no.
No.
I'm just saying for a policy,
no,
maybe it's for the policy committee, if you want to change the underlying statute that says they have to do it. Maybe every 3 years they should come in and request it instead of just making it automatic.
I can talk with my house counterpart.
Yeah, because we'd be yelling at them if they didn't do it and we told them they should.
Right, like if it's statutory required, that's different. But maybe we don't want it statutory required.
Exactly.
Automatically every 3 years without looking at what it's gonna cost.
Do it on request.
So there's these health equity grants. And I had asked you, Amy, about a job position. Is there a job related?
They have, so they have a position now related to these funds, and I think they're advertising for the position now.
So the Office of Health Equity resides within the Department of Health now. Is it like a division, or should they just call it the office?
Just an office.
Office of Health.
The directors.
And is the directors who they're hiring?
Yeah.
So the director isn't different than this. It's this director of the Office of Health Equity that would be issuing these grants.
In that office, yep.
You're right.
Yes.
But that was an FY '26 budget request. I assume that was new position.
So there was.
Or we already approved it for last.
It's already been approved.
Okay. Okay. But then there's the contingent fund for, what are we calling it? I don't know, there was a different name we were using it, but basically this is to help either substance use treatment facilities or other healthcare providers that, it's kind of an EEF for these different providers that if the Department of Health sees that they need money to stay open and they're providing these critical services to Vermonters, we would want them to have that money. So that originally the department on the sheet, it says 4 million, but you should cross that out and put 10 million.
And the added language to include FQHCs.
Oh, this is the 10 million.
This is,
That's why
this is the line item, it
Yeah.
started,
So it's
this
not-
sheet is a January
It's
10th.
10 million, yeah.
And it,
Because 4 million is what they thought they needed for the substance use residential facilities. But since there's some other FQACs, they wanted 10 million. And that's, but that 6 million change lowered what they said they were gonna put forward till next year for the drawing down the property tax rates.
Mm-hmm.
That was gonna be 83 million, now it's 77 million, because they put more money into this one.
Can I ask, and I don't know if anybody would know this, is the House gonna up that number, the 10 million?
I heard they're just gonna up it to the 10 from the 4 on the request of the administration. But I also heard that they were going to put some language around it. Because when it was presented to us, it had no language.
Yeah.
That was gonna be my question.
They have some language about the expansion to FQHCs and that in their language.
Yeah, because I met yesterday with the FQACs or representatives and one person running one, and they seem to feel like the 10 million would get spread around so much that it wouldn't accomplish.
Insufficient.
Yeah, so I wasn't sure if the House was contemplating more or we should contemplate more.
Yeah, we could definitely have Department of Health, or I don't know who this is going to have Department of Health in to explain it more.
That'd be great.
Or just
I
have
would
fresh.
think the Commissioner of DEVA, Deshaun Grove, is probably the person to talk to.
And then, yeah, we can have that discussion with more.
Everybody's cash on hand, hospitals, FQHCs,
Right.
insurers. It's like very depressing.
Yeah.
Tell me about it.
Yeah,
And maybe after he comes in and testify, they'll be able to know what FQAC is.
Yeah.
Federally
What?
qualified.
Federally qualified health center.
Federally qualified health center.
And the federal designation for federally qualified health centers is they're in areas that are underserved and they get a higher Medicaid match rate at 125%. And if you're in a poorer community and Medicaid pays less than commercial insurance and you don't have anybody in the commercial insurance world to shift some of your costs off onto, that jump in the Medicaid rate helps you able to survive. But generally, all of our, and most of our primary care in the state is now run through FQHC.
We have like 14 of them.
And there's,
My next question.
and there's probably at least a third of them that are in financial distress.
Now, who would that be as a You got 14 of them.
I have one, my district, Plainfield Health Center, called
Plainfield Health Center.
Memorial Health
You
Partners.
probably have one in St. Albans.
Yeah,
Yeah.
I'm sure we do.
Yeah, didn't we have a letter that had a list?
There's a map, I've got a map on my
Yeah,
thing.
if you were to Google, you'd see the list of all, some of them are, most of them are called town health center, town name health center, but other ones, some of them don't have that name. And some of them are tied to a hospital.
The one in Gifford is tied to a hospital.
Right.
To the one in Randolph.
Right.
And you could apply to be a federally qualified health center, but you gotta go through the federal process to get that, so they're very valuable for those communities where they are, because it's almost like a little hospital. I think all of them have dentists as well,
Most
and it might even be required.
Some of
There
them
might be
have-
one in Richford.
No,
There might be one in
there
Richford.
is one in Richford.
Yeah, that's it.
Yep.
That's it.
Yeah, okay.
Yeah.
They're beginning to have more mental health counseling and expand in that way. They also have less expensive pharmaceuticals, like pharmacy supported by
To
the.
have the dentist, that's what key to.
That was the
Richford,
key,
yeah.
that was the
Right.
key.
And I know in Plainfield, a lot of people use that if they're only access to dental care, because a lot of the private dental practices aren't taking any new customers. And I think the FQACs can't turn anybody around, they might just be
No, they
a long
can't.
waiting list.
They can't turn anybody down, but your problem is they have a Medicaid caseload that is so high.
Yeah.
They
They
have,
can't survive.
they can't, well, they can't cost shift onto anybody with private insurance.
Because they don't have the
So-
space. So
Right,
they-
and they're stuck with their, what they get paid.
Right, and even though they get paid more than others, it's not sufficient. So, we'll talk more about about that issue. So the mainframe support for Department of Children and Families.
Hi, this is Gary from Fuel and Fuel.
That's your second strike today.
Wow, one more, I get booted out.
Next, we're gonna be calling Senator Starr.
Yeah, I love how Russ shut it off on, it still went off. Good job.
Okay, yeah, this is general fund and federal funds to keep that computer. I think they've been working on this computer changeover for years, have they not? I think I heard about that the first time I got elected 6 years ago. And then that's more computer work for children and families.
Child welfare information system.
Yeah, we already know. But for Department of Children and Families, but for a different program.
Yeah, different.
The global commitment match. Times. And then this, we were gonna have the treasurer, we would have heard about this today, the last one, the B1100, the one time, the state treasurer's office bond redemption. This is money that the Department of Finance regulations paid back to the treasury before we had, the administration had proposed and we had accepted to give money to the treasurer to pay off bonds. We had bonds that we were paying, paying the interest rate on. But they said, if we have extra money, let's just pay off those bonds. So they gave them, I think, 20 million or something like that, right? Or something like that, and they were doing that. But then when the floods hit, they wanted to take some of that money out of there to pay for the mobile home repair program and another program. And they said, we'll take this out of the bond repayment, but you gotta pay it back. So now finance and management is paying back the money that was taken out.
Okay.
And I think the treasurer has some ideas for some of this money. And because they don't see a real value in paying off some of these bonds, because some of the bonds are at interest rates that are lower than the interest we're getting. So we're making money. So if we paid them off, we'd be losing money. So they're saying if we're only borrowing at 2% and the money in the bank is we're earning 4%, why would we pay off the bond? So that we're gonna hear from the treasurer's office on it. So then we get to Agency of Commerce and Community Development. This is the first one. This is just a transfer.
And this is a technical correction, it was appropriated in the wrong place.
Right. So that's the first two are just the ups and downs, the same thing. And then the Natural Resources Board is getting it off. But I thought when we looked at this before, wouldn't we see an up in the Land Resource Board or whatever? What's the new Act 50 board?
Land use review board.
Land use review board.
So you would think we'd see in here, Land Use Review Board needs money. If we're taking money away from natural resources, because we're ending the Natural Resources Board, right?
Defunding her.
Isn't that down in, like the matching one is in D101? I guess I'm just saying that there's a
I see.
matching.
Act 250 permit fund?
Yeah.
So-
permit fund.
So maybe the permit fund is what's gonna fund the Land Review Board, so that's, okay, so that's the other side of that. Okay, so back to the top of that section, general obligation bond, debt service. It's not controversial. There. Emergency relief assistance fund. What do we use an acronym for this? Or what do we?
EREF?
EREF, that's what it is, yeah. This was funding that we used to help pay the town's share of match, right? So, because some of these towns that had a lot of flood damage, even though they only have to pay 10%, FEMA pays the rest, that 10% was, so we kind of paid it down to 5%. With this money. I don't know if the EREF still has money in it.
It does, but it's sort of obligated for other projects that they're aware of.
Right, okay.
And this is money that's already been spent, right? Like this is gone.
I think they're taking money out of the special fund, putting it into the general fund to pay out these matching.
Yeah, so it's the opposite.
Yep.
It's taking it from general fund. So now we're.
Oh, right.
It's-
Because we're in reversion,
Taking it,
it's the pluses and minuses have the reverse meaning.
Yeah, okay,
I
gotcha,
remember
thank
that.
you.
Yeah, so we're taking out
But
the
it's
general
what-
fund and
it's
putting in
there's a
EREF.
need
Those are
of the special.
what colors
fund,
were
so-
EREF is the special fund, and they're gonna need more money. And the medical insurance fund, this is this deficit capitalization, which I find is an interesting term. Where because of increased expenditures on parking costs, this is for the states, because we self-insure. We can't just go to the insurance company, there was a deficit, they want to put more money from general fund into that fund. This would be, I don't know, this is a question that I have, is what if we weren't to do all 18.5? Like, what if we did 17.5 and wanted to increase money for FQACs, for example? Can this, what's the ramifications of carrying this deficit in this medical fund? What does that mean? So we might want to have the commissioner back to specifically talk about that.
Where would you put the other million?
Well, I just said, for example, if we heard from the FQAC, the Federal Qualified Health Centers, like 10 million is not enough, we wanted to raise it to 11 million. Should we take it from there, or would what would be the hardship?
Have to pay for the drugs.
Well, yeah, but they already paid for the drugs and they're 18.5 short. But I don't, and what I don't remember, if 18 after like 1 year, or is that
Right.
like slowly built
Right,
over
does it
years?
perpetuate the problem or not? Yeah.
Yeah,
Okay.
or, and is it just kicking the can down the road, and even
Yeah.
if it is, do we still wanna do it?
Yeah, gotcha. Good question.
Nolan might know. And the medical insurance fund, the deficit capitalization, is that 18.5 million, was that accrued over years, or is it just like last year, there's a huge pharmaceutical?
There's actually, if I recall, it's like, there's like a $64 million deficit and they're paying over a couple of years. There's a chart that they have that shows what it was in the past and how it was in positives and over years and the negatives. They're doing a piece in VA, and I think they're doing another infusion in the budget, to try to shore that up.
Okay.
I do have charts on it.
I think he presented charts to the House
Yeah.
that we haven't seen, so we could have them come in and.
They did a nice job. They laid out very, very, very well.
Yeah, I think the House, after hearing a more detailed description, felt like it was prudent, but we haven't gotten that.
Yeah, you'll get it. I recommend having DHR in it. The chart list speaks for itself.
Okay. The Correctional Industries Fund. This, I remember them talking about that. This is because of their changeover of how they were doing the workers in the corrections, if I remember correctly, right?
I'm sorry, I was not.
The Correctional
Yeah.
Industries Fund.
Oh, right. So they had, they had been spending in this account without having revenue from.
Right, because they were still making some furniture, but nobody was buying.
Right.
Basically.
Right.
And I think they're also ending that fund, if I remember.
Good furniture, man.
Yeah. But that's another one, I guess, like, I have to remember what all that is, because their note over here just accounts for 92,000 of it. So what's the 3 million? That's just their running deficit.
Over the years, yeah.
They're closing it out, like they're not gonna have this fund anymore, because they're not selling anything.
Right, I think so, yeah.
And did that include the license plates also? I thought they mentioned.
It is part of the license, but the license plates they're still selling to DMV, so I assume that I don't know if that's a separate fund.
That is a great question, I think it too.
Yeah. Back to 50 permit fund, we already talked about. Cannabis regulation fund. This transfer, what was this transfer for again? Do you remember it?
I'm sorry, which one?
I know, you're typing, but the cannabis regulation fund, 3.45.
Amended estimate for actual amounts. So this is saying that
If you have to look up 7 VSA.
you're aligning the actual transfer.
Well, we went through that with them.
So this is just like the 7 VSAs where it talks about how the excise tax gets divided up. And so this is just, and this is an example of taking money from the special fund, putting it into the general fund. Basically, opposite of liquor and lottery.
Right.
People are drinking less beer, but they're using more cannabis. And so the cannabis revenues was higher than we estimated. That goes into the general fund. But then liquor and lottery, it was mainly around the sports betting. Because we're such good bettors. Okay, so page 8. Page 9, which is the last page. And then, so the liquor control fund, is this the same kind of thing that this is, which could be called a deficit capitalization? They had been running, they had been giving the general fund more money than they should have been, given sales declining. So unless people start drinking more, this is what's gonna happen.
I'll help out.
Help out. Because I think they showed us, or sometimes I get it mixed up with that tobacco fund. The tobacco fund is a similar thing, where it's just like moving $20 million into the general fund, assuming, no, the tobacco settlement is different, because that's settlement. This was just, they were moving a lot more money every fiscal year, but sales of liquor continued to drop. I think there was a little bump during COVID where more people were staying at home drinking, but that has ended. The litigation special fund for tobacco. This was maybe the question mark.
Oh, I remember they were putting it somewhere else where they were using it for something.
Yeah, and projected year-end
Commissions,
surplus.
judges, I think that's where the money went.
Where'd it go?
So they're taking money, but this is taking money from the general fund and putting it into the special.
That's right. So I think there was an overspend of the tobacco special fund last year. I think that's what this is saying. And then we're putting money that we spent back into the tobacco.
Okay. And it's different than tobacco settlement total thing in the question. We have a request from the parent-child centers to take some of that money.
To use it for smoking mothers.
Right, for
$500,000.
Right.
Yeah, it's $500,000 now.
Because one of those positions come from the tobacco fund that we approved in judiciary last year for the judges. The other two were in the budget, go to recommend, and one was it wasn't $1.6 million.
No.
But over several years, there would be usage of this. I think that's what it is.
It's leading to 1.6 million, so maybe it was, maybe there was more than one transfer, is that what you're saying? But this is a 1.6 anticipated FY26 year-end deficit. So if it's 1.6, why are we putting in 3 million?
That's a great question, why they picked that amount.
So we
should ask that question.
Who does that? Did we decide before that would be Gresham too, if we talk about the tobacco settlement?
So, yeah.
So let's have Gresham or whoever is in charge of the tobacco fund.
It looks like they're trying to make up for a larger deficit than $3 million, and that's.
So, because I also have a question, which I think is really for the FY26 budget about the parent-child centers, not the VAA, but it's good to know more about that. Okay, workforce education and training fund.
That was what labor was came in yesterday talking about.
And then the brain injury fund, TBI is that they're just closing out that fund, $1,500. Unclaimed property fund, the treasurer was gonna talk to us about that, just for some members understand what that is. Be prepared, you might wanna look for your name in the unclaimed property, because if your name is in there, the treasurer might say it on the record that you have money that you have.
I hope he does.
Sitting there. But the first year I was on the committee, I went and looked, and my wife had like $14.
Oh.
That was, she was owed to some refund from Google. We had no idea why it was there.
My uncle got 12 grand.
12 grand.
You're kidding.
It was some insurance settlement that was actually from his mother, and had been sitting there for years.
Yeah.
They went to check, they went to the property.
Nice. Great grandparents' hometown. So it's good to look at and they have changed the law, because I think when I first was on there, found out about the $14, but didn't want to fill out the form to get the $14. I never got around to it, but I was told later that you can just go and, if it's under $25, they'll just send you the check, you don't have to
Nice.
fill out the form. But we'll hear about that from the treasurer. This $3 million for the entities insurance and special regulatory funds, I can't remember what that was.
Financial regulations had.
Oh, yeah. Diminished. So there was a question about some of the fees that we had increased caused this decrease in revenue. So it's I guess we'll see over time, since some of those fees are new, if this is ongoing. And then there's all the reversions. We also are gonna have the Deputy Commissioner of Finance and Regulation, Hardy, come in and talk about all these 19 million of reversions, in case there's a whole list that aren't listed out here. They're on some other document we got, but we're gonna go through those reversions of education fund we weren't gonna go over. Because that's my positive for the education fund. So that is all of the budget adjustment recommendations that we have to go over. And then, as I said today, the House is doing a straw vote. They're gonna work on Monday. As House approached us, so Brennan, you have to come in on Monday, if you want.
Aren't you glad you moved out?
I am, it was well worth it.
I don't think we've worked, I think we've only worked like one Monday the 2 years that I was on this committee.
Mm-hmm.
So it's pretty rare. So then we'll hear next week what the House did. We'll maybe get some more information on some of the questions we had. And then I was hoping by next Friday, we would kind of know where we are at, more or less.
We'll get a side by side.
We'll get a side by, Emily will come in and say this. So they're not gonna actually vote it, they'll vote it out of committee on Monday, but the whole House won't vote it out until Friday. But we can probably be pretty ready, so when we get it the following week, we could see if we, what changes we wanna make, assuming, I don't know if there's ever been Senate concurrence on a EAA, but.
I don't think complete concurrence.
Yeah, but there's probably always a reason to have a conference. So then we'd have a conference.
Usually they make mistakes and we fix them.
Yeah, that's why we're
That's
there.
not what I heard over there.
Yeah, you're gonna have to change your own message.
Unless you're Allison. Allison has yet to switch up.
Yeah.
No.
Some people's alliance. Okay, so that's the plan for next week, is hearing a couple of things from this and hearing from the treasurer. And then we'll make some decisions. All right, okay, with that.